92.3 Inspiration FM.
Your number one family radio.
Do you know many patients face risks while receiving care in the hospital? Tune in to DRASA Radio Half-Hour Show every Wednesday from 11:30 a.m. to 12 noon on Inspiration 92.3 FM Lagos and learn about patient safety as we explore simple tips to create safer hospitals and healthier communities. Don't miss it. Safety starts with you.
You are still listening to Inspiration 92.3 FM, your number one family radio. It is time for DRASA Half Hour. Interesting conversation we're going to have today. This special edition is dedicated to patient safety, as always. That's what we've been discussing since the start of the show. And for those of you who don't know, it happens every Wednesday, 11:30 all the way to 12 o'clock. Now, DRASA stands for Dr. Ameyo Stella Adadevoh, the courageous doctor who identified the first Ebola patient in Nigeria in 2014, but later died after contracting the infection from a patient. Her action saved the lives of millions of Nigerians who will always be forever grateful for her courageous act. And as a non-profit public health organization, DRASA Health Trust has since, its establishment in 2015, continued her legacy of protecting the health of Nigerians, and they're constantly working to develop health champions like you and me who can identify, and prevent infectious diseases and influence those around them, which is basically the goal of the show anyway. So we have two representatives who are going to be talking about today, which the topic for today is patients' right in health facilities. And first we have Christopher Aliyu, a program manager at DRASA Health Trust. He is a psychologist with over 10 years of experience in public health program management with a focus on behavior change communication and prevention programs. He is also an expert in human and organizational capacity building. You're welcome. How are you doing today?
Thank you, Kafaya. I'm doing great.
Holiday's over. Welcome back to work.
Yes.
And the beautiful lady in front of me in glasses, Beatrice, you want to tell us who she is?
Yes, she is Nurse Christine Akoa, a project associate at DRASA Health Trust. She's a certified nurse midwife who is experienced in clinical nursing, school health, and illness and disease management, with a focus on ensuring wellness in rural and urban communities. It's great to have you here with us, Nurse Christine.
So, interesting conversation because I'm produced, right? I think we had a tiny bit of we had a conversation briefly about this. Patient rights in health facilities, which is a major problem in this part of the world.
Yeah.
So let's talk about that.
Thank you. Good morning, Lagos. Good morning, Nigerians. There's so much to reflect upon right now. I mean, yesterday was Independence Day. There's a lot we're discussing as Nigerians, but it's very important that we look at the rights of Nigerians. I mean, sometimes we've heard people say, I have a right to speak. And, in these times where we feel like we need to advocate for good governance, people say, I have the right to peaceful assembly, right? So another right that we want to discuss today is the right of patients in the health facility. So when we consider the right of patients in the health facility, what are we talking about? We're talking about those sets of rules that, guide the conduct of patients in the health facility, that protect patients in the health facility while they are receiving care. So what is patients' rights, right? So those are the rights that guide. We can look at it from the perspective of, the responsibility that a patient has, in the health facility, and also the responsibility of the healthcare providers, like the nurses, the doctors, and the rest of them, to the patients that they attend to. So we're going to be talking about a few of those rights today. We have a very short time. Number one that we want to consider is the right to access care. Everybody, if you are sick or maybe you have injury, you can go to any health facility to access care. So we've had instances where people, have been denied care, maybe accident victims or victims of armed robbery, and you heard stories about people going to healthcare and then they are not allowed to access care. So whether you are a male, female, whether you are black or white, whether you are poor or rich, the same access that a rich man should have to healthcare is the same that a poor man should have. Right, so it should never be a case where anybody is discriminated against because of maybe their background or where they are from, in terms of accessing care. That is number one. Now, number two, we want to talk about the right to information. Now, it is the right of every patient that walks into a health facility to have access to information. And when we talk about information, we're talking about information regarding what is wrong with the patient, right? What the health condition of a patient is. You have the right for your healthcare provider to explain to you in details the condition that you have come to the hospital with, and then the treatment options that are available for you. Even when you are going to be presented with your bill to pay, you have the right to ask questions about what are you paying for, what are the medication that have been prescribed for you as a patient. So that is another right, the right to information. And then the third one I will quickly speak about is also the right to privacy and confidentiality. It is the right of every patient to have their medical record or medical information, kept private by their health provider, and except maybe when they need to share with every other, healthcare worker involved in their care. It is the right of patients to have their medical information or records.
That's the doctor-patient confidentiality clause.
Yes, you're right. Of course, we know that there are some instances where, because of legal reasons, these medical records needs to, to be shared. You see people going into military service, and the government demands that they share their medical records, right? You also see NYC corps members when they go to the camp, and you hear that they need to provide certain medical records and all of that. So apart from in these conditions, a patient's information should never be shared with any other person except by their consent, right? So the right to confidentiality and privacy is another important right that is very, we're looking at today. And because of our time, I'll just speak briefly about one more right, and that is the right to consent. If for any instance, maybe a patient has been diagnosed with any ailment that requires a surgery, the patient has the right to information about what the procedure is all about. The patient has the right to give consent to either receive that care, to either go through that operation or not. It's very important that you don't impose these services on any patient that walks into the health facility. So it is their right to decide that, okay, I want to go for this surgery, and I don't want to go for this surgery. We've heard cases about elective surgery, right? You decide that you want to give birth and you don't want to go through normal delivery. You elect for
a CS rather than doing the normal.
So these are the four rights, and it's important. When we say a right, it means that it has a legal backing. It's contained in a legal document that we call the Nigerian Patient Bill of Rights. The Nigerian Patient Bill of Rights. All of these rights that we have just discussed now, and some others that time will not permit us to share, are contained in that document. I hope listeners, if you're out there, if you've not heard this before, this is a legal document that backs these rights up, called the Nigerian Patient Bill of Rights.
Because a lot of people do not know about this. That's the problem. A lot of awareness is not done enough for patients to know that they have rights in health facilities. So you don't I'm sorry, some doctors and nurses can be very pushy to force you to take procedures that you don't want to want to take. And at that point, it feels like, don't I even have a say in what you do to me, or the sort of medications or information? Like, I do have a right. And that's one of the issues that we have in this part of the world. And I like the fact that we're talking about it, that we have rights and we should talk more about it and create more awareness for it. All right. Okay.
So that's over for me. I've just spoke about 4 of them.
Okay, and we're going to go to the beautiful lady in front of us. Please just move that to you. So what else do the people need to know? Okay.
Okay. Thank you, Mr. Chris. I guess it was an interesting one. But something we're going to talk about right now is patient advocacy. So when we say patient advocacy, what we simply mean is how to stand up for your rights as patients. And it's quite thrilling we're talking about this because, like you said, Kafai, a lot of people do not know what their rights are or even know how to stand up for their rights as patients. So this can be done in 2 ways. And the first one is that you'd, while you're receiving care, and if any form of harm or negligence or anything at all is being done to you during the point at which you're receiving care, you notice, I don't like how this doctor is talking to me, or I don't like how this nurse is attending to me. The first way you can advocate or stand up for your rights is to first engage with that health worker. Express how you feel about what is being done to you. If it is a violation, if it is harm, if it is negligence, if it is disrespect, first engage with the health worker and let them know what it is.
But what if they're not forthcoming? forthcoming. That's another thing.
Yeah.
If they're not forthcoming, and you don't have anybody to properly explain things to you, then what step? Isn't there a number or somebody that we can call? And is this only applicable to public healthcare or private hospitals? Because that's another thing.
Yeah,
it's like I think the law applies differently to both hospitals. I don't understand.
Well, the truth, is this whole thing applies to whether it's a public or whether it's a private. So, like your other question, what if there is nobody we can talk to? Oh, there are people we can talk to. Like I said, the first thing is to first engage with the health worker, right, and let them know what is being done that you don't like. So the second thing is, which is another way you can also, stand up for your right, is that if there is nobody listening, or if the health worker is not listening, you can actually report the health worker, to a higher authority, and these authority are the ones that would now help you, that is guide you, that is resolve your complaints, right? Like we mentioned, you have the right to ask questions and get honest answers from the health provider, but at the same time, it is first good that you speak up rather than stay silent. And if after doing that there is nothing going on, then you report the health worker. And you can actually report to, there is a system in health facilities called Servicom. What that means is service compact with all Nigerians.
Oh,
yeah. Okay. So you can find these people in many health facilities, and you see their offices.
Oh, I've seen them.
Yeah.
Yes, I've
so
seen
you
them.
see a small desk, or when you're walking into the health facility, you just see them by the side, maybe around the nursing station or behind the nursing station once you walk into a health facility. But the Servicom desk is always going to be present in health facilities, such that they have a role to play. What they do is to ensure you receive good service in health facilities.
And they actually come through?
Yes, they do.
Because sometimes when I walk into the hospital and I see them there, I think it's just for fashion. And they're not even doing anything. But they actually work. Because that's Nigerians, we have that. They'll just sit down there. They don't even know what they're there for. That's the thing.
Yeah.
Some people see them there and they don't know what they're there for, what they do.
Yeah.
You understand? Until somebody actually tells you, oh, okay, you can go meet them if you have issues or whatever. So...
yeah, this is why we're talking about this. So all Servicom desk you see in health facilities, their role is actually to ensure that you receive good service from a health facility, and they will look into whatever complaint you bring to their desk and then ensure to try to resolve it for you. So primarily, whatever is going on in health facilities during your point of care, that Servicom desk is actually there to be able to ensure you receive good service and resolve any complaints you bring to them. And it's actually very interesting because some facilities have a Servicom compliant, that is a suggestion box, where if you don't want to speak in person, you can write.
I see that box. I know that box.
Have you used one before?
I think I have at a point.
So you can actually drop your your written complaints there if you are not if you don't want to speak in person, and the officers responsible would actually look at it and try to resolve whatever it is you've written on paper. So if you're unable to visit the Servicom office in person, you can contact them via a hotline or email. I think that's what we can actually find online once you Google whichever hospital or health facility you're receiving care.
Are they in private hospitals as well? They're not just public?
Yeah, they are. At least I've visited few private hospitals when I go for care. I've seen Servicom desk actually, yeah. So you would find their contact information written even on the notice boards of health facilities. Like you said, most people don't know why that is there. Yeah,
they
so
just see, okay,
exactly.
Nobody's telling me anything.
Yeah, so you find their contacts on notice boards. So you can also even ask a relative or a friend who is knowledgeable. Maybe if you have a health personnel with you to at least follow you during your point of care and just go and help you understand the process more, to help assist if you need help to write your complaint to that office and all that. Now, if you've gone to Servicom and still feel like the issue is not well addressed, this is where the Ogbonge comes up. Yeah. Okay. So you can take things a step further. The Nigerian Medical Association, that's the NMA, that's where they come in. this body actually oversees the general conduct and ethics of medical doctors and dental surgeons in Nigeria. So whatever these people are doing, these health professionals are doing, the NMA are actually responsible for addressing whatever complaint comes to them that a medical doctor had done, or maybe a dental surgeon had done, maybe if it's in terms of negligence or harm during your process of receiving care.
It's fantastic that you're saying this, but what's the response time? That's another thing.
We're in Nigeria.
We always have someone to report to.
Yeah.
And send our complaints to. Is when action is actually going to take place to resolve my complaint and my issue. That's the actual problem.
Yeah.
Is it going to take forever? What's the response time like? Even with the Sevicom and also with when I submit a complaint to the NMA as well. What is the response time?
Well,
how quick are they to attend to complaints when they receive it?
The honest truth is we have these people, right? Even if time is a problem, I think another thing we also have to look at is trusting that they would actually respond, because 1,000,001 people could actually be responding and sending their complaints to them, right? So I think it's going to be in order of whatever comes to them and the evidence available to actually be able to stand up for these patients, right? So they actually respond, they actually ensure whatever comes to them is addressed properly and on time. Like I said, the evidence you bring, that's why if you want to actually report or take it a step further to the NMA, what you need to do is you write a detailed report of whatever harm or negligence you notice happened while you're receiving care, and you include relevant documents. You need documentations. Okay, I was given an injection, I was not told why. After receiving that injection, I started having issues, blah, 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 blah. You write all that. Then, your supporting documents, what injection was given to you, right? Do you have record for that? Do you have a bill for paying for that medication that was administered to you? So all of these things are the things you'd couple up together.
Evidence.
Exactly. So that evidence, I believe, is going to help track and engage the level of time they need to actually be able to address that. Because whatever you present is what they can use to say, oh, this is what came from this patient and this is what we are finding.
That is why documentation is
exactly
very important. Keep all the papers,
all the
papers, receipts, all everything.
Exactly. So whatever you receive, those are relevant documentations for you. So when you're reporting to them, you have evidence. Then the NMA can also help investigate the matter that has been reported in writing. Whatever serious case it is, no matter what it is, they will ensure that your right is well addressed and all of that. So that's just it, basically.
I hope with these few points of ours, we have not been able to come through, and at least you know a bit of your right now as a Nigerian, as a patient. Because it's very, very important. You need to be aware. God forbid anything goes wrong. You know the next step to take and what to do. But we don't just talk serious stuff. We also give you an opportunity to win stuff on the show as well.
Yes.
We love freebies. And I know you people out there listening, you like freebies. So it's an opportunity for you to call in and win something amazing on the show. All right. So Beatrice is going to be asking, no, not Beatrice, you guys are going to be asking the questions.
Yeah, we will.
You're going to be asking the questions to let us know exactly, what exactly are they winning again? Let's tell them what they're winning.
Just the DRASA hygiene kits. It might just be but there's a lot of goodies inside the bag. Yeah.
All right. So number to call, guys, is zero. What's the number, Beatrice?
0700 923 923 923. That is 07009 23 923 923. That is the number to call.
So that's the number to call if you want to win goodie bag. See, it's goodie time. Let me do the shakara. So we're done with the serious talk, and it's time for us to ask some questions. But you have something to say, Christopher?
Yeah.
Yeah. Thank you very much. I just want to add just one or two things. I mean, we've spoken about the patient's rights in the facility. So something very important that we also need to take note of are those very, very vital information that we see around the health facility that we call non-verbal communication in the health facility. And these are sets of instructions that provide information about the kind of health services that these hospitals offer, and also the kind of ways that you need to protect yourself within the healthcare facility, some preventive actions that you should take, right? So it's important that we look out for those signs in the health facility, and we call them IEC materials: information, education, and communication materials. It's very important that we look at those things, because we had COVID, and then currently in Africa there's a Marburg virus, and you see instruction about how to wear mask, why you need to wear mask, how to wash your hands to keep yourself safe and prevent the spread of infection within the healthcare facility. So it's important that we also take note of some of those signs as well.
All right, so we have our calls coming in already. 0700 923 923 923. Hello, good morning.
Hello, good morning.
Hi, good morning. What's your name?
My name is Uche.
Hi, Uche. Uche, where are you calling from?
I'm calling from Surulere.
Surulere. All right, Uche from Surulere. Are you ready for your question?
Yes.
Fantastic.
Okay. Uche, the first question is, what document contains the list of patients' rights in Nigeria?
Okay, it's called the Nigerian Patient Guild of Rights.
Congratulations.
Uche, what's your full name?
My name is Uche Opara.
Uche Okpa from Surulere. Congratulations to you. They will get across. Just send his phone number as well. All right, so send us your phone number. Send your number to the WhatsApp number 0817-313-6193. Send your name, your full name, and your phone number. Please do it now.
Okay, I'll do that.
All right, thank you. Congratulations. Hello, good morning. Call us back 0700 923 923 923. That is the number to call. Again, 0700 923 923 923. We're looking for 4 winners, 1 down. We need 3 more people to win amazing prizes from DRASA today. All right. And I know you love freebies. Everybody loves freebies. There's nothing like having a good hygiene kit where you have all your goodies in there. I mean, I love having gift bags. There's nothing I love than gift bags. It just makes me feel very good. So if you want to win something, just call the number. Hello, good morning. The devil is a liar.
0700 923 923 923. That is the number to call to win yourself a hygiene kit from DRASA today.
All right, call that number. We're looking for 3 more winners. All right, Uche, don't forget to send your name and your phone number. Don't let it enter voicemail. 0700 923 923 923. We have a few more minutes to go to get at 3 more winners. Hello, good morning. Hello, good morning.
Hello.
Are you there? Good morning. All right,
what is happening? We don't want to go with this goodie bag.
If they don't call, I will collect the goodie bag for you. Hello, good morning. Call the number 0700 923 923 923. That is the number to call. You don't want us to go away with it. I will just collect it from them. If you people don't want it, I'm going to collect it. Very simple. Hello, good morning.
Keep trying. 0700 923 923 923.
I don't want to say spiritual, but things are happening.
Things are happening.
The after holiday fever. Maybe the phone lines are tired and they need one more holiday or something. I don't get it. 0700 923 923 923. We're looking for 3 winners. Okay, so Uche has sent his detail. Thank you very much, Uche. So we'll just take a snapshot of that. Uche, congratulations again. We're looking for more winners. While we're doing that, we might go on a commercial break. Hello, good morning.
Hello, good morning.
Finally, you beautiful woman. What's your name?
Fine, and how is yours?
My sister, I'm doing well, but I want to get to know you. What's your name?
My name is Gloria.
Gloria, are you still sleeping? Gloria, ginger up now. Don't you want to win goodie bag?
I'm just a bit cold.
We are going to give you that goodie bag to make you feel warm. Are you ready?
Yes, I am.
All right, Gloria, but you're going to have to speak up so we can hear you clearly as well. So please increase your volume, all right? So listen to the question.
So, Gloria, list 3 patient rights we discussed today.
Sorry, I didn't get that.
List 3 patient rights we discussed today.
Oh, wow.
Oh, wow.
Do you want to try, Gloria?
Were you not listening?
Oh, wow.
Oh, wow. I love the fact that she just said, oh, wow. But you were listening now. Can't you remember the 3 patient rights that we discussed?
In fact, there are 4 of them, and we just want 3.
My sister, I cannot remember.
Yeah.
Give me a simpler one.
Oh.
Please.
What did she say? What
Give
did you
you a
say?
simpler one. I'm not sure we can.
Oh, please.
Okay, yeah, go ahead.
Okay. So, what do you do if you do not feel respected while receiving care in a health facility?
One can report.
Okay.
Report to who? Report to who?
To NME
Okay.
and also back it up with your documents.
Okay. Okay.
We got your choice.
Okay.
Yeah.
Yeah.
This is all about education, right?
Yeah.
So when we say enemy, we mention Servicom as well. So
Yeah.
it's important that we know service compact with all Nigerians. The awareness is going around. So
Yeah.
All right. So, Gloria, I need you to do something for me. I need you to send your full name and your phone number and location to the WhatsApp number right now. Do you have the WhatsApp number?
Yeah, I
You-
do.
Yeah. Oh, your
Now
phone
she's
don't
active.
get- Don't miss something now. Your phone don't go.
Gloria, don't well, Lou.
You don't wear. I'm going to disappear. Oh, yeah, send your details now. Oh, don't sleep and forget to send
Yeah,
it no. All right. Congratulations to you, darling. We do not have time to take another call. Let's see. Maybe we can take one more call.
Yes.
0700 923 923 923. We have 2 winners already. Congratulations to Uche and Gloria. We're looking for 2 more, but we only have time for 1. So let's see who we have here. Hello, good morning. Okay, it's like as if they say we should go. All right, we have to go.
Yeah.
Let's go on a quick commercial break, and when we get back, we'll wrap up the show. We have just a minute to go. All right, don't go anywhere.
Do you know many patients face risks while receiving care in the hospital? Tune in to DRASA Radio Half Hour Show every Wednesday from 11:30 a.m. to 12 noon on Inspiration 92.3 FM Lagos and learn about patient safety as we explore simple tips to create safer hospitals and healthier communities. Don't miss it. Safety starts with you.
Still just a half hour on Inspiration 92.3 FM. We are done for today. Just to wrap it up, Christopher.
Thank you all for listening to us on the show today, the DRASA Radio Half Hour. This edition is dedicated to raising public awareness about and encouraging collaboration within patients, families, and communities, right? About how to keep our healthcare environment safe for the patients. So once again, we are Dr. Mayor Stella Adadevoh, called DRASA for short, a public health non-profit organization, working to develop health champions like you and I, who are identifying and preventing infectious disease. You can do well to follow us on our social media channels. We are at DRASA Trust on Facebook, on Instagram, Twitter, so that we can continue this conversation. A lot of interesting things that you can learn. We hope to be back in the studio next week.
All right, and that's it today. Coming up at 12 o'clock is the world news, and after that, 12:15, it's Sports Waka. We'll be back.
Jam in music, you can feel